You're in the right place if you are looking for the COVID-19 town hall, separating fact from fiction. My name is Elaine, and I am with the Senior Planet San Antonio team. As a little bit of background, Senior Planet is an arm of the nonprofit organization Older Adults Technology Services, or we go by OATS. And we provide free technology classes and services, help support to anyone over the age of 60 throughout the US. We also have a specific team in San Antonio serving the Alamo area. And I'll be making sure that towards the end of the hour, you know how to find us online and can tap into our hotline if you have any questions or if you want to connect someone else to tech support. Our mission is to help make sure that older adults are able to access learning about and using technology, harnessing technology to meet their own personal goals. And so we have over 50 online classes that are free. We offer Monday through Friday, and we'll direct you to those at the end if you want to check them out. But that's not the full purpose of this event. This event is to make sure that we are informing our community about how to respond both post the statewide disaster situation of last week and specifically in a pandemic. So knowing that we are handling quite a bit, and we want to make sure that everyone has resources at their fingertips to advocate for themselves and their community. Okay, so at this point, what I'd like to do is to have our two speakers introduce themselves. I know that we did advertise that Councilwoman Gonzales would be on, so we'll wait. If she comes in, we're going to be happy to invite her in at whatever point she can make it. I know you both have really busy schedules. It's almost like there's stuff going on in Texas. So, Councilwoman Viagran, if you'd like to introduce yourself, the work you do, and your background as a San Antonian.
Hi, everyone. My name is Rebekah Villagran. I am City Councilwoman for District 3 in San Antonio, Texas. That is the south and the southeast side of San Antonio. The area that I represent is 84 square miles, so it's a pretty large area. It's about the size of Seattle, Washington. Represent about 180,000 constituents, predominantly Latino constituents, young, and the average age is around the 30-year-old range in my area. Also very much the older part of the city. We have the only UNESCO World Heritage Site in the state of Texas, and that is part of the area that I represent. So we have a great mixture of families that are older or younger, but I will say this, many of the people that live in my community in the district live in multi-generational households. That means we have grandparents and grandchildren and parents all living together under the same roof. And for that reason is one of the reasons why we've seen a very high significant impact of COVID in our community. So I like to call District 3, the area that I represent, the area that represents the past, the present, and the future of San Antonio. I am a lifelong native resident of San Antonio, Texas. I'm proud to be serving in my 8th year on the City Council, and we'll see where we go next, but I'm so happy to be here and to discuss this extremely important issue for all of you here. Thank you for having me.
Thank you, Councilwoman Viagran. And then we have Dr. Ochoa, who may be frozen for just a beat here. So while her internet kind of measures out, these are the casualties of meeting online, right? I'm sure she's going to get back in as soon as her internet works. And not coincidentally, we are an organization that advocates for the strengthening of our infrastructure in the San Antonio area for providing access to internet for every single person. And you may notice that you might have difficulty in maintaining a strong internet connection depending upon what part of the city you live in. So we are working to make sure that we have initiatives that meet that need and bridge what we call the digital divide. So Dr. Ochoa, so good to see you back. If it works best, you can turn off your video too for a little bit to introduce yourself. Hi, Dr. Ochoa.
Can you hear me?
Yes.
Excellent. So I missed a little bit, but you're asking me to introduce myself. Am I correct?
Yes, you are.
Sorry, it was weird. I'm like, I have 5G. How did my internet go out? So I'm Dr. Lisa Ochoa, and I am a vascular surgeon. And what that means is that I'm a specialist that takes care of all the arteries and veins in the body. I've been practicing in San Antonio for 10 years. And in the last 3 years, I started my own practice called the San Antonio Vascular and Endovascular Clinic, or the SAVE Clinic for short. And the reason I did that is because I saw a need for dedicated specialists in our most underserved zip codes and areas in San Antonio. And one of the healthcare outcome markers that I follow are diabetic amputations. I'm not sure if many of you all know, but San Antonio has some of the highest diabetic amputations. But if you look in our south side, near east, near west side, they're exponentially higher than even in Texas. And so I have focused my practice in serving those areas. My average age patient is not in their 30s, it's in their like 60s. But I do see patients all the way as young as 30, all the way to as older as 85. The most common issues I see them for are peripheral arterial disease or bad circulation to the feet. But my patient population are kind of those that are all at highest risk for what we're talking about right now, not only for COVID pandemic, such as diabetes, high blood pressure and stage renal disease, but also the stressors that happen in any kind of crisis situation. So thank you for having me. I'm honored to be here.
Thank you, Dr. Ochoa. And actually, since you brought it up, can you name some of those stressors that you have been seeing and you're trying to meet and serve the population dealing with those stressors?
Sure. So another way to put that, and for me and my patients, is called social determinants of health. And those factors affect us normally, affect us during, even more so in a pandemic, and then maybe even more so in the crisis we just had. And so those things can be something for, in my world, such as health literacy, even understanding the disease processes. And I think when we talk about COVID-19 vaccinations, health literacy has a lot of barriers to it. One big other social determinant of health for me is transportation. And so trying to get patients to doctors' offices or to clinics has been challenging. Not only that, it's the stressor of the unknown. And so what I've been seeing a lot with my patients is, well, they know they have an appointment with me, but we have COVID, and who knows, is it safe for me to go see you? Is it not? And so what I've seen is a lot of my patients that have these kind of different stressors in their mind, they choose just to do nothing. And sometimes that's the worst decision for them to make at that time.
Thank you for that background. And that actually leads me into a question I have for our audience. And again, you are welcome to chat by directly messaging Phyllis. And the way you can do that is to find on your menu of options, the same menu that you see start or stop video, you should see a chat. You might need to click on 3 dots, which will open more menu options. And then you can open up the chat. And all you have to do is tap to start typing and then type a message and hit enter. And to direct it to Phyllis, if you see that little 2 area, look for Phyllis Q&A, select that, and it will go directly to her. However, if you accidentally send it to someone else who is one of the hosts, we will make sure to bring up that statement. I also, to help us get started here, wanted to launch a quick poll for everyone on here. If you see this pop up, and the question is, in which San Antonio district do you live in? So if you know, feel free to let us know which district you are in. And that will give us an idea too of how to direct you to resources in this session. Like Dr. Ochoa mentioned, we are going to be getting into the state of being able to access vaccines, what's the easiest way to connect, and also any questions that you have or that you have heard of. So right after this poll, I would welcome you to also let us know how have you been experiencing this vaccine registration process? So if you've had challenges, please let us know, send that message to Phyllis, or if you're on camera again, you can raise your hand. Let us know that you would like us to unmute you, and we will be happy to do so. Okay. So I'm gonna share the poll really quickly. Here you go. We had a few people do it, and if you're a host or co-host, if you're a panelist, you won't be able to take it. So for those of you who were able to take it, we have a pretty wide distribution for this session, with folks from District 1, District 3, District 9, and District 10. I'm personally in that District 5, close to District 7 area. So thank you for that, for letting us know that. And we're gonna have a few more polls throughout the session. So if you see that pop up and you're able to click, it's very helpful to let us know. All righty. So Phyllis, have we been getting any thoughts about challenges so far in trying to register for the vaccine?
No comments as of yet about the challenges, Elaine, but I'll let you know.
Okay, thanks. And again, I'm gonna look through the video really quick. Anyone who has their video on, if you wanna share, if you just raise your hand and let us know if you've had any issues. But since we have Councilwoman Viagran on and Dr. Ochoa, who see people every day who are calling with issues about accessing the vaccine, I'll turn it to Councilwoman Viagran. What are some of the things that you have been hearing are difficulties or uncertainties, concerns in trying to get access to the COVID-19 vaccine in our community?
Well, I think number one, the issue is supply of the vaccine, having enough of the vaccine to go around. That's number one. Number two is making your appointments. You know, in San Antonio, we intentionally made appointments we intentionally created a telephone number. We wanted access by telephone only to schedule an appointment, because it is not easy to get on your laptop, your computer, or your smartphone to quickly get online and sign up for an appointment, to go to a website and sign up for your appointment. It's not that easy for me or anyone. So we created the telephone number. It's a 800 number for people to sign in, but the complication and the difficulty that we have for that is there are so many people calling. I think, Dr. Ochoa, we heard just a little while ago, you know, we're making appointments right now for the remainder of this week and all of next week. And we've scheduled about 500 at one site so far, but at one moment or today, we've had over 600,000? Over 600,000 calls come into that phone number. So the need is great and people are looking for it, but they're getting a busy signal and they're trying over and over again. People are taking about 500 to 600 to 1,000 attempts a day to get through. That's why we're having about 600,000 calls come into that phone number. So those are some huge barriers there. But right now, part of the issue is we have to work within the parameters that the state allows us to work, and also get to the community that is the most impacted and the most vulnerable.
Thank you. That is quite a mandate to try to meet all those needs. Dr. Ochoa, what are you seeing in terms of older adults' needs and trying to access that vaccine?
Right. Well, like Councilwoman said, I think our biggest challenge is we don't have supply, and so right now the priority the state has is our kind of big vaccination events. And so I have to say, I am so thankful that our councilwoman on the South Side worked hard to get a location that's physically on the South Side. I can tell you that my patients that have called, and they tell me they've called 500-600 times, that they wouldn't have even tried if it wasn't close to where they were. So just being geographically closer to them made it as a possibility for my patient to say, yeah, I can give it a call and I can show up there rather than travel a lot farther. What we're also working for, there's a lot of independent physicians who work kind of deeper out into these communities of need that have the highest rates of diabetes and high blood pressure and kidney disease. We've been asking the state, hey, why don't you give me, I can't do 1,000, but I can probably do 100 if it's even with my patients. And so we're still waiting to see if that distribution to private practitioners is going to come to the state. Eventually it will. When we have enough supply, that's how we're going to get it into the depths of our community. And so I can tell you, I know that there's a lot of our local physicians waiting for that time to be able to vaccinate their own patients.
Thank you for that. And we have had Councilwoman for District 5, Shirley Gonzales, be able to join us. So we want to welcome you, Councilwoman Gonzales. And if you'd like to introduce yourself and just let people know a bit about your work and your background as a San Antonian.
Great, thank you very much. And so forgive me, mom duties called, and so I got distracted. But thank you all for holding down the fort for me. And of course, I got to hear Councilwoman Viagran and Dr. Ochoa, who I thought explained it beautifully well about sort of the trouble that we're having with access to the vaccine. I'm Shirley Gonzales. I am council member for District 5, the near west side and the near south side of the city. And of course, I'm sure that we have talked about how heavily impacted our community has been from COVID. I know I've attended a funeral almost once a week this whole year. And so it has been so tragic, but people are so still very hopeful for the vaccine. And I know that we did a couple of food drives over this last week. And the one thing that everybody said was, we're so grateful for the food, but where can we get our vaccine? And so I understand that there is, of course, some hesitancy, but overall what we're hearing is that people are ready to get their vaccines. I did get notice today that one of our senior housing senior living centers, it's an independent senior living, did have everybody vaccinated today. So I love the idea of having a location on the south side, on the far west side, but really the best, I think, or at least the people seem to be most satisfied if you actually go to their home and get it through the Meals on Wheels program. And we know that there's this other option as well. So I'm grateful that we have new leadership at the top to hopefully start distributing, and especially grateful for my council colleagues for organizing, of course, Dr. Ochoa for being so willing to help get the vaccine in order and get everybody ready and informed and ready to get their vaccination. So thank you for letting me come in the program, even though I was so late.
Thank you for being here. So you bring up some interesting points about people needing to be informed of how to get it, where to receive it, and also that obviously we like to go with those we trust. So if we know someone comes into our home, we trust that they're already following COVID-19 protocols, that is a good connection, and that relationship of trust is so important. So I'm going to launch a poll for our participants that is asking exactly that. What is the best way for you to receive information? And we have by newspaper, TV, news, radio, online, the social media app, text alerts, and automated phone calls. And I'm going to keep asking, if you want to send a question via chat, please send one to Phyllis Q&A, or thoughts and experiences. If you've gotten the COVID-19 vaccine, you had a good experience, or you know someone who's an older adult in your life, who had a good experience, please let us know. Or if you have real concerns about it, this is a great time to voice those concerns. We have an expert, a doctor on the line, and we also have two folks who are experts in making sure to connect the community to good resources. So we're here to make sure you come away with the information you need. And I see, what is the best way for you to receive information? We have TV news, online, about 38% of people looking online, social media app, and text alerts. Okay, so seems like nobody's a big automated phone call fan. Just good to know. And we don't have any people looking at the newspaper on this session, but it's good to get that information. And Phyllis, our Q&A maestra in the background, is also taking photos, making sure we document the poll. All right, so we have a lot of questions. What's most important is anyone who has joined the session, especially any seniors in the San Antonio area, we want to prioritize your voice. So again, if you have questions, comments, you feel free to raise your hand, wave your hands if you're on video, and we will make sure to spotlight your voice and make sure that question gets asked and answered.
So Elaine, we did have a question from Yolanda, and I'm seeing if she replied to my direct message. But what she asked is, she's saying it's hard to schedule appointments. Can y'all speak to that on with personal providers and with the internet that we have going on? She's not sure where to call, and we're definitely going to give the number so to her, but can y'all speak to that? The online providers, the internet online appointment page that the city has, things like that.
Okay, I can't speak to the personal physician providers. Maybe Dr. Ochoa can, but at the city of San Antonio, well, in the city and in the county, right now there are about 3 ways for you to sign up for a vaccine. One is the university health system is one way that you can sign up to get, if you qualify in phase 1A or 1B, to sign up right now in this online, but that's only online. And we can make sure that we send you the link so you can put it in the chat. And that's one way, and University Health System is only doing it online. Second, the City of San Antonio Metro Health has the Alamo Dome that is a mass vaccination site. You can do that with 311 by calling 311 and setting up an appointment, or you can also go online to schedule an appointment when they become available. And then third, the phone number for the WellMed location, 833-968-1945. Don't quote me on that. We'll get it for sure. I'll get the right number for sure.
It's 1745.
1745. Okay, thank you. So those are the 3 ways. So one, strictly all online. The second one, online and telephone. And the third one, all by telephone. So those are the ways that you can sign up and get your vaccination appointment. And also, just so you know, if you are in San Antonio, and I saw the text alerts, we just put out a text alert saying that we are now going to be letting the community know via text alert when vaccines are available, at least through the city, WellMed, and University Health System. UT Health, which is also a mass hub site or a hub site, they're only going with their patients right now and working out some other details. But Dr. Ochoa, the private physicians?
Right. So right now, most of us private physicians are not getting vaccine distributions. I know doctor that I work with who actually got some early on, only got their second doses, not getting them now, and I haven't gotten any doses that I've asked for yet. My plan for right now is my small amount that I get, if I do get it, will be to vaccinate my highest risk patients in my office, who, like I mentioned, my patients have diabetes and heart disease and end-stage renal disease And so really that's the population that I worry most about. Those are the ones that if they do get COVID, they have the least reserve to be able to mount an immune response and more likely to have complications.
Oh, and one more thing I forgot to mention, I think that's kind of one of the issues we have are we're watching the news, national news, and we hear so many different things like, okay, mass vaccination sites, mega vaccination sites, pharmacies are getting some. And yes, some pharmacies are, but we're not sure where they are. And we try to go to the Texas DSHS site to see where to find it, but you still have to call that pharmacy and you still have to register with them. One thing that we do with our sites, UHS, the city, and WellMed, is we're not charging or asking for insurance because we want to take away as many barriers as possible for individuals.
That is great to know. Thank you for sharing that. And for Councilwoman Gonzales and anyone else, is there anything else we should consider at Senior Planet, because we are reaching out to older adults every day that maybe we haven't listed yet in terms of ways we can connect them to registering for their vaccines?
Great. Well, thank you. I think the Councilwoman covered everything very well. Thank you, Councilwoman Viagran. I was looking at everything. I think you got it all. So thank you for that. And I also just received a text message a minute ago saying we have more vaccines. So we make sure that people connect in that resource to getting the vaccines. But, I mean, I just, as I was, picking up the kids and all that, I did hear on the news just a moment ago that the Johnson & Johnson vaccine was approved. So, and that should be out next week. So one of the things I think, in San Antonio, I really am so proud of us in that we have, first of all, a lot of potential resources. We know in that very early round, some private pharmacies got the vaccine, and I know tried to, it was always first, they had to serve that population, the first 1A population, but we have a lot of resources for drugstores. So I don't know about you, Councilwoman, in District 3. In District 5, we actually do have a pretty good assortment of different pharmacies. We have several CVS, Walgreens, HEB, and then of course we have like Davila Pharmacy and Carvajal and some others, private doctors. And I also have the UHS in the near downtown and the Texas Diabetes Institute, which is part of the network, which we hope can all be sites, eventually to connect people to different healthcare. We have pharmacies, retail pharmacies. What we don't have a lot of is medical care and medical providers in the district. So once the vaccine becomes readily available, I believe in District 5 we'll have pretty good resources. I know that District 3 is much larger in terms of your geographic area, but we should be covered pretty well if that a third round comes and we start having more distribution. I also believe that the city and the county have done a great job, and of course WellMed, of distributing vaccines and having a very good customer response. My understanding, whether they went to WellMed or to the Wonderland Mall or to the Alamo Dome, they had a very positive experience. So I think all that is really important, and just so shows that San Antonio is prepared in any way that more vaccines come available.
Thank you, Councilwoman Gonzales. Go ahead.
And if I can add to that, one thing that we have also done, at least at the Alamo, and we're learning, is where we were at one point having people park, get out of their car and go up and get the vaccine. Now it's all strictly drive-through there because it's more efficient and they've found a way to make it efficient. So even through the mass vaccination sites, we're still learning how to find efficiencies.
Elaine.
Yes, I want to introduce a senior we have on team, Pat Hasso.
Thank you, Elaine. One of the things that I wanted to comment on, which is a positive comment, the fact that I've noticed that the bilingual part of this, of notifying people via text, this is so important because one of the articles or newscasts I was listening to was talking about that our population a lot of times is hesitant to come forward because they don't understand, because nobody has communicated to them about the COVID. So the fact that you all are doing this bilingual in Spanish, I noticed on the text and all that, that is to be commended. And I encourage that and say to them, to everyone that I come in contact, yes, Elaine's right, I'm one of the seniors as well, but I come in with people that are much older as well. And so, but always encouraging them that that is nothing to be afraid of. And I think that that's so great that I see the text that just came out and continue to come out and explaining to them in Spanish about how they need to and why they need to be taking this vaccination so that they're not scared about it or hesitant about it. So I just wanted to say kudos for doing that. Thank you.
Thank you so much, Pat. And as you can probably tell, Pat is an incredible advocate for the city of San Antonio, for the people of San Antonio. And we are lucky to have her on the team, which leads into a question I have for all of you. What would you suggest are ways that older adults can advocate for themselves in this process?
This may seem obvious, but I'm going to say it anyway, is I think a lot of my patients and older adult, they're nervous to ask questions. And so they simply tell, Doctora, whatever you say, I will do. I said, but no, you need to understand why. I want you to understand and be bold enough to ask, and ask all your doctors, why am I taking this medication? Why you're recommending this lifestyle treatment for me, whether I ask them to quit smoking or exercise or not drink Big Red, or why am I asking them to take the vaccine? And so I think empowering them that their questions are important and they should be answered and validated. And I always tell them that any physician should be able to answer any of these questions. And if they don't, then maybe you need another doctor. No, I'm teasing. But so I think that's part of it, is taking ownership of their health, asking the questions and understanding the why to everything.
Thanks. Does anyone else want to speak to that in terms of working as a representative of local government?
Well, one of the things that I wanted to highlight is one of the ways that we've been vaccinating people in the district is through community health workers. So we've been working very closely with our community health worker program here in the district, and they're the ones that go door to door. And like Lisa was saying, Dr. Ochoa was saying, is that these are your comadres in the neighborhood that can really give you the information that you need to even just to direct you to your doctor, because sometimes, once they have gone to the doctor, possibly it's been too long. And then there's a multitude of problems. But the community health workers are currently in the district really going door to door advocating. And so one of the things that we know we need is more private care physicians in the district to really work with our senior community, because they do go too long between appointments. And a lot of times they really don't understand why they need to do certain things. So I think, having that advocate as a community health worker, and I know that I felt like I had read in I don't know if it was with your organization, Dr. Ochoa, where you did have kind of like an assistant or somebody in the practice that their job was really to explain to people. So you have the doctor doing it as well, but there's also somebody in the group that's taking a little bit more time to explain what the perhaps side effects might be, or something like that, like a community health worker or a caseworker. So I know that is starting to become more common. And so I hope that, we can continue to use that practice when we're talking about the vaccine.
Thank you, Councilwoman Gonzalez. And actually, could you explain a little bit more about the Comadre program and the Door-to-Door program?
So the city of San Antonio has a community health worker program. It's something that we've had for a long time. I had some that I worked in my community with domestic violence prevention, but now they're in the community registering seniors for the vaccine. So, and they're going door to door and explaining people and giving them appointments. And so we tried to do that internally in our office to, work with our constituents and using the same system, but, trying to register for them, just like we know that, like the same way that I registered my mom and her friends for the vaccine, trying to, utilize the community health workers to register people. But the city sponsored actually had reserved appointments for people. And I can't remember if it was 1,000 or, but it was a lot. I want to say there was 1,000 appointments. Maybe that's too many. Anyway, now I'm getting confused with all the numbers, but it was a very generous amount, and they had the appointments scheduled. So that was an example of one thing that the city is doing to register people in neighborhoods that really needed it.
I'll just say I absolutely agree with Dr. Ochoa. What seniors can do is advocate for themselves, advocate for, ask the questions, the whys, and remember not to be afraid to ask questions of your doctor either, because, you're still paying them. You may not have that, check or anything like that, but they're still going to get paid by you going and visiting them somehow, some way. So ask the questions. If you need more clarity, ask for more clarity, ask for them to send you to somebody else who needs more clarity. If English isn't your first language, you ask them to bring you somebody who can explain it to you in your language that you feel comfortable with, because that's your right as a patient, and they should be explaining that to you. So it's absolutely critical that you do that, and you encourage your friends, your other friends who may be seniors, to ask the questions. Hey, you're always questioning something else, so question your doctor too. Don't be afraid.
Thank you. I'm going to launch a quick poll for participants. We'll just take a minute to do this really quickly. We're rounding out the hour pretty fast here, folks. I'm getting a lot of information out there. We are going to do a follow-up article and make sure that all these resources are compiled for you, that you'll be able to find if you keep an eye out for our newsletter, and I'll also show you how to sign up for that at the end of the hour. So we found out so far which districts you're in. We found out how you like to receive information. I'm going to launch a poll, which you'll see pop up on your screen, and it asks, what resources do you need right now? So we have water and food, and you're able to choose multiple choices here. Help fixing damages from the storm. I just got a text alert from the City of San Antonio government saying that they've set up something online to help people know about what services are out there. A vaccine appointment, which is probably why you're here, and transportation, and finally, help getting online. So please take a few moments and let us know where you fall in terms of needs right now. I did want to quickly ask for those of you, especially Dr. Ochoa, for our speakers, we do offer some tech classes that address how to use telehealth, just very basics, what to expect, how to advocate for yourself in telehealth. What role do you think telehealth can play, and how would you encourage people to learn about it, navigate it?
You must have read my mind, Elaine, because I was thinking another thing our seniors can do is learn how they can get information themselves if they're not in front of their doctor. And believe it or not, being online, being comfortable on a computer and accessing telehealth is something that I would love for my seniors to get comfortable with. And we talk about when we now have COVID pandemic and we now have these urgent issues, would it be great if they were comfortable with a telehealth visit that's routine? So then when it's an emergency, it's not this sense of desperation. So I've actually used telehealth when the COVID pandemic first started. The challenges that many of my patients have had, one is simply understanding how to use their smartphone and the camera. Two is some of them don't have all the minutes because they buy so many minutes on their phone, and to do video telehealth takes up a lot of their minutes. And then some of them don't have it. They only have flip phones. So there was a lot of challenges that I found my patients had. Yet they or their children or their grandchildren all have access to some kind of online. And so I encourage my seniors, like, if you can't do this or don't know how, well, you have a son or a daughter or a grandchild that can help work through it. And so my advice to them too is practice doing a telehealth visit with your doctor. Like, choose that just so you get used to it and it's comfortable. So if we ever become in an emergent situation, it's easy for them.
Thank you. That's a great idea. And actually that leads me into your next question. I'm going to share the poll results. We had a pretty strong response for people needing a vaccine. And 60% of folks, 40% of folks who wanted help fixing damages from the storm. So, and I want both those things, so throw me right in there. My next question is, speaks to something that you brought up, Dr. Ochoa, getting ourselves ready to respond, not so much to always have a response, but to be prepared to take in stride when we have crises, emergencies. I mean, we've been in a bit of a crisis for a year, a sustained crisis. And then we went into having a statewide disaster from Mother Nature. So, and part of that too is how can we plan? How can we deal with that? So this goes out to all of you. What are some things that worked for us? So thinking about specific resources in our area that worked well last week. For those of us here, a lot of us didn't have water, power, certainly internet, a lot of times even cellular service. So what were some things that seemed to work even under all those stresses? And what can we build on in the future?
That's, not much worked last week. Let's just say that. Not water, not power, other stuff didn't work very well. But what did work is connecting with your neighbors and getting to know your neighbors and your community. I will say the stories of my neighbors, the stories of the residents in District 3, they saw their neighbors in need. If they had a generator, they told their neighbor to come in and charge their devices or will cook for you or provide water for them. That's what I saw work. I saw people step up when you're like, hey, I needed this. When we were setting up our warming center, I told somebody, hey, this is what we need. They're like, we've got this, we'll do this, without hesitation. So that's what worked. And whenever we told somebody, hey, check on your grandparents, your older neighbor, that's what people did. And they physically went over there and checked up on them. And when somebody saw somebody was in need, they provided water or food or something. So I think out of everything that was highlighted and that worked yesterday, last week. And anything else?
I think that's great, Councilwoman, because I have to say, like, I felt a little paralyzed by your question because I feel like we're still in it. Like, I mean, we haven't fully recovered. I mean, I know that, for us at least, that we were really working nonstop until yesterday. We were providing hot meals for people. And the reality is, I think afterwards, like, so many people came to help that ended up being, it made it ongoing, which, of course, we were extremely grateful for all of the generous support, which will give me an opportunity to thank Texas Central Kitchen, who, with the help of several other and many restaurants in the district, I'm going to get in the city a whole list together so we can all patronize those restaurants when we have a chance. They were paid for their services, but not sufficiently. But we've delivered or given over 10,000 meals. I'm sorry, yes, 10,000 hot meals in the last few days. So the support was overwhelming, but in the depths, the deepest part of the crisis, I think the Councilwoman's right. It was really your own neighbors that helped, because for us, we were out all of power for all those days, but the neighbors across the street had power, and so did the people behind us. So that people were checking on each other. It's kind of like every other block was out. And so people that were calling saying, well, we have power, but these people don't, can you send resources to them? So, and so the one thing that did work the entire time were our phones. So, I mean, we couldn't do the computer, our Wi-Fi went out, but our phones still worked. So I thought that was, I was grateful for that too. So it really was that peer-to-peer, neighbor-to-neighbor support. And bringing over hot meals to them. We had a gas stove, so we could at least boil water during that time. But there's nothing like the support of your immediate neighbors. So I hope we can continue that that kind of a neighborhood relationships, because when it really comes down to a crisis like that, it was like the only thing that really did work. So thank you for highlighting that. And I'm going to have a whole list together of all of the people that came and offered support. And that was the other thing, is that so many people were offering so many things, but yet we really didn't, we were even a little bit powerless to figure out, well, how do we then accept all of the support? That I know the Councilwoman had a warming station over at Brooks, and I thought that was great. They must have really come in, the neighborhood association, and of course, I think that you guys had a warming center there. So anyway, I'm so profoundly grateful for everybody that came in. But I would think that, for the seniors, if you did have some sort of texting, capability to then do some sort of blast text or, something like that, if you were okay, because we didn't quite have that system in place yet. I don't think so. Thank you for that. I'll turn it over.
So other things that worked, I'm going to say, is our healthcare workers, and I'm not just talking about the doctors. I'm talking about the nurses, the LVNs, the techs, and the cath lab, and the OR, the janitors. So we had several hospitals in San Antonio with no water. Downtown Baptist, Southwest General, North Central Baptist. And there were literally staff that spent the night in the hospital because they knew they weren't sure they could get back or come back, and spent the night there to make sure that patients were cared for, and that if there were still emergencies, they were still there. And so I have to say that worked. Our healthcare community in San Antonio were dedicated to taking care of our people, of our patients. And so a lot of them sacrificed the comforts of their own home and taking care of their own families to make sure that our most vulnerable are taken care of in the hospitals.
Thank you for sharing that. We are coming right up on the hour here. I have one final poll. I did want to again embrace anyone who is in the audience who has a question that hasn't been answered yet. This is your chance. Wave your hand, turn your video on, wave your hand, let us know you're there. We'll make sure to unmute you. And while you're at it, if you can make some choices on this poll, this is, what is your preference to stay connected to your council member's office? We have email newsletter, mail newsletter, online, so the website, social media app, text alerts, and automated phone calls. So let us know if you're on this session, you're probably pretty tech savvy already, so we're not going to be too surprised. But yes, if you have a final question, please do send that to Phyllis in Q&A or raise your hand on screen. All right, I'm going to end the poll and share it with everybody. Okay. So we had a big turnout for email newsletter, mail newsletter too. Some people still look for those for sure. And it's a great way to share with your neighbor too. If they don't have an email, a big part of this is you got a lot of information today. Please share it. Find a way you can share it with the people in your community. And then social media app. All right. Phyllis, do we have any questions that came in?
No questions, and I don't believe they're still on, but some frustration because the links are down for some of the university health sites because of the amount of requests and stuff. So that's just that was from Yolanda, but it looks like she has left. But yes, that was it for questions. I don't know if Pat's still on, if she has a question. I also see DL Laser, if they have a question for us and want to ask.
Sure. And again, feel free to just turn your video on and we'll make sure to unmute you. And we've got about 1 minute left in the hour. I wanted to thank everybody, to thank our speakers for spending their time with us, because like they mentioned, it is ongoing. We all know it's ongoing if you're in Texas. So we're working to rebuild and we're working to plan for better. At the same time, we're still kind of in it. We're still working for a good night's sleep. But we're so thankful for the work you do, your teams have done, your staff have done for this entire year, obviously, but also especially for the near sleepless nights of this past week. So in wrapping it up, I want to say thank you to everybody. I am going to make sure to put some resources in the chat. And if anybody wants to have some closing remarks, this is your opportunity.
Thank you all very much. Thank you, Senior Planet. Oates, we're so glad y'all are here in our community and what you're doing. And thank you for having this. I hope you can continue to do this.
Yes, thank you. And so one of the things that I think, Dr. Ochoa mentioned it, but we are finding that that people actually like this format. Of course, we all sure miss everyone, but when it comes to appointments with their doctors, I'm understanding that people are really liking it. It's at least been my understanding that that people like this format. So hopefully we can blend it into whatever comes next. And so I'm grateful that people are starting to become more tech savvy, and that, when it comes to socializing or parties, well, obviously this doesn't work. But when it comes to just getting information or having forums like this, we are finding that it helps people participate. And just for me, and I saw Lisa had somebody in her background that, if you don't have to pay for a babysitter, it's helpful. Maybe the seniors don't have to worry about that as much. But it is, I think it allows for more participation in many ways if we don't have to leave our house. So thank you. Thanks for hosting us.
I just want to say thank you again, and I'm excited to hear about Oates, and I may be reaching out to you. I'm always looking for ways to find services for my patients. So if you could help teach my seniors how to get in touch with me via telemedicine, I'm going to be calling you.
We definitely look forward to that. So please do connect with us. We'll make sure to follow up. And also, we're about 2 minutes over the hour. I'm going to share my screen very quickly to show folks how you can find out about all of our programming, because we've got so much going on. We've got a lot of exciting things on the horizon too. So this is the ad for this event, COVID-19 Town Hall. So you may be familiar with it. You might have found us by clicking on the Zoom link in this event. And it's on our page, seniorplanet.org. We are an official partner with AARP. We're really happy about that. That's a new development in 2021. And we're in multiple locations. So if you want to find out specifically about San Antonio programming, we welcome you to click on our locations and find San Antonio, click, and it will load a page that shows our hotline number, which is 210-504-4862. If you want to make sure to stay connected to these resources, follow up, connect with our team, learn about those classes. That's going to get you to our local team. And then finally, you'll also be able to see our upcoming events. So I did want to let everybody know we're having a fun virtual bingo and games event with Councilman Manny Pelaez of District 8 coming up on Friday. You can just click on an event and it will open up that same page with the Zoom link to head directly to the event, and you'll be able to learn more there. So with that, that's everything I have. Phyllis, is there anything that you would like to share before we wrap up for the evening?
No, I'm good. Thank you, everyone.
Excellent. I want to thank my my co-hosts, Phyllis and Jonathan, who are part of the Senior Planet team. We couldn't do it without you.